Welcome to today's edition of ISM's Quick Tips podcast series. I'm Ron Gates, one of the Senior Field Advisors with ISM Insurance Incorporated. What I would like to discuss today are changes you can expect to impact your school concerning the Healthcare Reform Act. Throughout our Healthcare Reform podcast series, I'm going to look at important dates and changes that are mandated to take effect. For this second presentation, I'm going to be discussing changes that will go into effect on January 1st of this year, 2013. There are 4 changes impacting schools for the new year. The first of these we'll take a look at is the Medicare tax increase for higher earners. Healthcare reform increases the 1.45% Medicare payroll tax on workers' wages to 2.35%, or a 0.9% increase on earnings that exceed $200,000 for an individual filer or $250,000 for married couples filing jointly. The portion of the Medicare payroll tax paid by the employer will remain at 1.45%. Healthcare reform will also impose a new Medicare tax of 3.8% on the lesser of a net investment income including interest, dividends, royalties, rents, and other passive income, or on the excess of modified gross income that exceeds that threshold of $200,000 for singles or $250,000 for married couples filing jointly. Another policy going into effect is the Form W-2 reporting of the value of employee benefits. Employers will be responsible for reporting the total costs incurred for providing health care to employees. Specifically, W-2s for the 2012 tax year must include the aggregate cost of an employer-sponsored group health insurance coverage plan, excluding any salary reductions for deferred to a flexible spending account and all contributions made to a health savings account. Aggregate cost is the annual cost of the insurance and includes any portion paid by the employee. Employers may use COBRA rates without the 2% administrative fee to determine the value of benefits. Tax years beginning on or after January 1, 2012, with the cost of the employers to be the first reported on January 2013 Forms W-2s. So what does this mean for you? The W-2 reporting currently is only in effect for schools that have more than 250 employees on their payroll, and that will include all full and part-time employees. The other changes we just spoke about are really a function of payroll, and it's important that you contact your payroll vendor and make sure they are prepared for health reform for 2013. If your school offers a flexible spending account program, you'll need to know about changes affecting those plans. There will now be a cap on health FSA contributions. Employee contributions to employer-sponsored health flexible spending accounts are limited to $2,500 in a calendar year. This limit will be indexed to inflation starting in 2014. The last change going into effect is the new electronic transaction standards. Group health plans must file a certification with the Secretary of Health and Human Services that their plan is in compliance with the administrative simplification rules to be published for electronic fund transfers, health claim status, and health care payments. Systems must be in place starting January 1, 2013, and employers must certify compliance by December 31st, 2013. Let's quickly review some of the key changes that will go into effect on January 1st, 2013. Medicare tax increases for high-income earners. Form W-2 reporting of the value of health insurance benefits. New caps on health flexible spending account contributions, and a new standard for electronic transactions. For more detailed information about these changes, we suggest visiting healthcare.gov/timeline. Thank you for joining me for today's Quick Tips podcast series. For more information about healthcare reform policies and how changes will impact your school, please visit isminc.com/insurance. You can also stay updated by subscribing to our position-specific monthly e-newsletters. ISM's monthly updates for business managers and risk managers, as well as private school news, are great resources to keep you current with what's affecting your position. You can subscribe by logging on to isminc.com/e-letters. Thank you again for joining me for today's podcast.